Hi, Dr. Greg Mendel, your friendly anatomy professor. Part 3 of covering the veins and arteries. We have chalk right here. We are going to continue on. Over here, I know we're moving around, I apologize, but we've talked about some important structures. One, going up was the common carotid artery and the vertebral artery. So we're picking up on those and going over here. So again, coming up into the neck, we had the common carotid artery. We also had the vertebral. I'm just going to put it dashed, and I'm just trying to represent that it's inside the vertebra. So as we have the vertebra here, we know that the vertebral artery is going through there. The vertebral artery is going to go up until it hits the foramen magnum, and the foramen magnum, that's a lot of vertebra. Way too many. It's supposed to be 7. But the foramen magnum is where the vertebral canal meets up at the bottom, at the base of the skull, and we have the spinal cord and the vertebral artery. It's going to be piercing into there. The common carotid artery, as we said, comes up and it splits into 2. One is going to go up inside the brain area, and it's going to pierce through a hole called the carotid canal. So that one is done. We have a second branch which is going to come up, and so we had the common carotid artery. This is the internal carotid artery. That was the vertebral artery. This is the external carotid artery. There are 5 branches that come off the external carotid artery. The first of which goes to the thyroid gland. The one that goes to the thyroid gland is called the superior thyroid artery. The next one is going to the tongue. That is called the lingual artery. Lingual for tongue. The third branch is called the facial artery, giving blood to the face. The fourth branch is the occipital artery, going back by the occiput. I drew it a little high. Honestly, that would probably be, I'm a little picky here, but it'd probably be closer to like that, back by the occiput. So we have the occipital artery. The next one, as we see here going up to the temporal side of the head, is the superficial temporal artery. Let me show you these on a skull so we all in agreement of what's going on. Here we see, and if we can come in, thank you. We have Brooke helping record. Thank you, Brooke. And so we see the vertebral artery coming up through here, and that's this one here. We have the common carotid artery here, which splits into the internal and the external branch. How do we know? Because the internal goes up, it may or may not be able to see it, into the carotid canal. The external carotid artery has the first branch going to the thyroid, superior thyroid artery. Second branch here goes to the tongue, which is lingual. Third branch to the face. Fourth branch to the occiput. And the fifth branch is going to be doing to the superficial temporal artery. We'll cover the inside of the skull in the next video. Thank you.